Hypertension can be defined as blood pressure sustained for extended periods above the normal range. It is a common myth that blood pressure above 120/180 is high. In truth, normal blood pressure varies from person to person. In old age, for example, it is considered normal for the blood pressure to go as high as 140/100 without damaging the organs. Regardless, hypertension can be fatal. It can also be a sign of an underlying disorder or the manifestation of a failing heart. So today, in this video, you'll find out what are the major causes of hypertension. Before we fully understand the causes behind hypertension, we need to understand the basics of the blood circulatory system. We all know that blood is connective tissue. It connects the whole body with a single stream of constantly flowing fluid, reaching every cell in every organ. It is carried into vessels called arteries, veins, and capillaries. The systems of a human body, however, are dynamic, changing with every changing variable. So how is the blood's flow rate maintained when the heart pumps slower or faster, like when we exercise? The collective pressure of blood against the walls of the blood vessels is called blood pressure. Everything from the strength of the heart's contractions to the squeezing and relaxing of arteries to the blood salt and water level accounts for regulating blood pressure. Sometimes, however, the regulators of blood pressure fail to act, and thus the pressure is sustained above an optimal level. We call this hypertension, and here's why it happens. Like many other conditions, high blood pressure has been in the spotlight for causing several lethal complications. Despite being the center of such abundant literature, hypertension has not yet been completely understood. What we know for sure is that it is a multifactorial disease. Many factors influence the progression and development of this condition. Similarly, many factors directly do not cause high blood pressure, but put you at risk of becoming a hypertensive patient. These risk factors include smoking, high body mass index, stress, sedentary lifestyle, and heavy salt intake. Similarly, positive family history and genetics also primary factors in the development of hypertension. To simplify things for you, let us explain the cause of hypertension with its specific type. There are two major categories of hypertension: primary hypertension and secondary hypertension. Primary hypertension, also called idiopathic or essential hypertension, is defined as high blood pressure in the absence of a single identifiable cause. Essential hypertension means that the reason behind sustained high blood pressure cannot be pinpointed. Many theories link essential hypertension to risk factors like genetic and vessel abnormalities, but hard evidence is yet to come. Unfortunately, 90 to 95% of all cases of hypertension fall into this mysterious category. Since a cause is not identified, this type of hypertension is harder to treat with medicines. Patients with this condition are usually put on smoking and salt restrictions and encouraged to pursue a more physically active lifestyle. Secondary hypertension happens when the blood pressure goes up for sustained periods due to some underlying abnormalities. In contrast to the first type, this type of hypertension appears as a symptom of an underlying condition causing it. The causes of secondary hypertension are diverse. For convenience, we can divide these into surgical and medical causes. Surgical causes include any abnormalities that arise due to an underlying anatomical defect. These primarily include abnormalities of the aorta or hardening of the renal artery, the vessel supplying blood to your kidneys. Such abnormalities lead to a responsive increase in the blood pressure due to impedance in its flow. Secondary surgical hypertension is often surgically correctable with a prospective outcome. Now let's talk about the medical causes of secondary hypertension. Medical causes of secondary hypertension include any cause that cannot be corrected through surgery. It can be as simple as sleep apnea and stress to as sinister as tumors in the kidneys. All causes of secondary hypertension, whether surgical or medical, which are related to the kidneys, have a few critical abnormalities in the center. One of them is an overreactive renin-angiotensin hormone system. This hormone duo is responsible for maintaining the blood pressure when the blood pressure in the vessels of the kidneys fall. An overreactive renin-angiotensin does not obey the threshold, and the blood pressure rises beyond the charts. The other abnormality is salt transport. Normal kidneys retain and excrete sodium in a delicate balance. Some conditions, like hyperaldosteronism and Little syndrome, can cause increased salt and water retention in the body. This causes the volume of blood to rise beyond normal. The arteries compensate by constricting, and the blood pressure rises. Another important cause of hypertension is a compensatory mechanism called heavy heart muscles or hypertrophy. This happens when an adequate amount of blood does not reach all body parts. It can be due to restrictions in one of the arteries, but the brain signals the heart to pump more blood, eventually leading to increased heart muscle size and elevated blood pressure. Long-standing kidney disease and pregnancy are also notable causes of hypertension. Rarely, tumors of the adrenal glands also manifest as hypertension. These are glands just above your kidneys that produce hormones that maintain the usual blood vessel's tone. Tumors in these glands can overproduce these hormones, leading to excessive narrowing of the vessels and thus higher blood pressure. Finally, some medicines can affect the cardiovascular system and increase blood pressure. Hypertension is a serious condition. Sustained blood pressure above 180 systolic can result in kidney failure in a matter of hours. In practice, blood pressure is a vital sign of health, therefore measured on every routine checkup. Although the answers to hypertension are still somewhat clouded, the condition is manageable. Low sodium intake, daily exercise, healthy eating choices are some of the best tips that you can easily incorporate in your life to prevent this silent killer, aka hypertension. Also, don't forget to like and share this video with your friends and family. If there's any specific topic you would like us to cover, let us know in the comments below.